Hi, I'm Megan Baker, and this is Influence Her, produced by Baker Public Relations. Jennifer Goldstock is a nurse practitioner and owner of SynRG Integrative Health and Wellness. She is helping women from all walks of life live their healthiest lifestyles, and she brings her own experiences to the forefront. Welcome, and we're so excited to have you here and be part of this discussion today.
Thank you. I love being here, and I really am grateful you asked me to come.
So you grew up in Germany, born in France, grew up in Germany.
Yeah.
You developed a smoking habit in your teens, and you've been very, very vocal about this. From that point on, you decided, because you were having chest pains, that you needed to take your health and wellness into your own hands. What was the motivator then and there that brought you forward to today?
So I started smoking when I was about 14. So I grew up in Germany, but my parents would have us spend our entire summers up until I was about 18 years old in Germany with our family. So that's where I learned how to smoke. In Germany, literally, they had cigarette dispensaries on the streets. You could just put in, a couple of bucks and you get a pack of cigarettes. So by the time I was probably 16, 17, I was smoking sometimes 2 packs a day. So when I was about 28 years old, I remember the day very clearly. I was making my bed and started having this intense chest pain. And I was having a hard time breathing. And looking back now, I think it was probably an anxiety attack, but it was literally the best thing that ever happened to me, because I basically said, okay, I'm done. I'm never picking up another cigarette again. And I didn't. And the only way that I knew that I could never pick up another cigarette again was to start a new habit, and that was running. And I bought myself a pair of running shoes, and the first day I literally couldn't make it down the block because I couldn't breathe. So I trained for a half marathon, and that's what helped me quit smoking.
That's impressive. Many teenagers wouldn't do that either.
Right. Yes.
So you spent many years, fast forward a little bit, but you spent many years working with HIV, AIDS, and cancer patients. What was it about that experience that led you to training with the Institute of Functional Medicine?
So HIV was very personal for me. I was living in Chicago in the late 80s, early 90s, and I had a lot of friends who were being diagnosed, and I lost 12 friends to the disease. So I knew at that point I had to do something to help, which is what prompted me then to go to nursing school and get my nursing degree. I was a flight attendant at the time, so that enabled me to get an education and fly on the weekends. I then transitioned into cancer care, and it was shocking to me that I did inpatient cancer care. So we did bone marrow transplant, and we'd have these very, very sick patients that we were treating, but we were giving them on their breakfast trays French toast with high fructose corn syrup, and in the infusion suites we would give them ginger ale with high fructose corn syrup, and we'd give them cookies. And I remember saying to the doctors, why are we feeding what we're trying to kill here? And I would just get these kind of blank stares, and I'd get laughed at, and I just knew that there had to be a better way to take care of people. So that prompted me to look into integrative and functional medicine. And then that's what started my pathway to where I am now.
For those who don't know, explain to us what that is.
So functional medicine or integrative medicine is it's a fancy word for the type of medicine that your grandparents grew up with. It's where you see a provider, and let's say you see a provider and you tell them, well, I'm having a lot of heartburn, or I'm having a lot of stomach issues. So if you go to your regular doctor, most of the time they'll say, okay, well, let me give you this drug and let me give you this drug. They're not looking at what's the underlying root cause of your symptoms. They're just giving you drugs and medications to treat your symptoms. But then what inevitably ends up happening is that drug then treats that symptom, but it shifts your disease to another location. So then you need another drug. So functional and integrative medicine looks at root causes of your symptoms, and we try to figure those out. And by treating those, we treat the whole person, and the whole patient gets better.
Why do you think that we haven't really adopted, as a country, this way and this approach as opposed to that conventional medicine model?
So that's a very slippery slope to go down. I personally believe that healthcare nowadays is disease management. It's no longer providing health or care. And I think a lot of that is because there is a very heavy influence by Big Pharma. And that's what's driving a lot of treatment protocols. I also feel like a lot of providers, especially doctors, are understaffed. It's more about the bottom line than it is the patient. They have 5-10 minutes to spend with you. They don't have a lot of time to say, hey, Megan, what are you eating? Are you sleeping? What's your level of stress? They have 5-10 minutes to, find a pill for your ill and send you on your way. And it's unfortunate because look at the American public. We are so unhealthy.
As someone who just turned 50 late this past year and has been suffering through the menopausal transition, you have taken a big interest in helping women like me. Why do you feel that menopause is still taboo today, especially with some of our healthcare, not all of them, but some of our healthcare providers, like our OBGYNs, which I've had my own personal experience with, where I was having mood swings, not sleeping, the weight gain, and they wanted to put me on a low dose birth control. It's not the answer.
It's definitely not the answer. Unfortunately, what you have to realize is your OBGYN, they are not trained in menopause care. They're surgeons. They know how to deliver babies, they do surgery, and they do it well. But when it comes to managing and balancing hormones, the only solution they have is birth control. And that's not treating the root cause. So all that does is shut down hormone production. Well, that's not ideal, right? So even prior to perimenopause and menopause, a lot of young women are having hormone dysregulation, partially because the environment, we're exposed to so many toxins in the environment. So the answer is always, oh, you have heavy periods, oh, you have acne, oh, you have mood swings. Well, let's give you this birth control pill to kind of shut down your hormone production. And lo and behold, sometimes they feel better, but oftentimes they don't. And unfortunately, birth control rinses out nutrients. It creates more anxiety. It kills your libido. So again, these providers, they're not trained to look at why are your hormones off balance. And as far as menopause care goes, that's a whole nother story. I feel like women, especially in perimenopause and menopause, are so marginalized in our healthcare system. And there's a lot of medical gaslighting that occurs. Well, you're feeling depressed and anxious? Well, let me give you some anxiety medication. Women are prescribed and offered anxiety medication much more than men. Or, you're not sleeping? Oh, here's a sleeping pill. Oh, your libido's, gone, or, you're having painful intercourse. Use some lubricant and maybe light some candles and get some lingerie. There's no looking at, hey, let me give you some bioidentical hormones. Let me restore your hormones so that you can feel better, so that your heart is protected, your bones are protected, your brain is protected. It's very, very rare that you see that in the conventional medical system.
So speaking on the topic of HRT, it has been previously very controversial. What is shifting about that?
Well, I think what's shifting is the science, right? The science has always been there. The science wasn't. So in 2002, the Women's Health Initiative, it was a very poorly designed study, and it was a poorly interpreted study. The media took a hold of it, and all the headlines said estrogen causes cancer. So women all over the country that were on estrogen therapy threw out their estrogen because they all were under the false assumption that estrogen causes cancer. So there's been a 19-year reanalysis that has shown that estrogen not only doesn't cause cancer, but it has protective benefits. So if a woman has been on estrogen at any time in her life, she has a 44% less chance of dying from breast cancer should she be diagnosed, and a 24% less chance of ever getting breast cancer. So, but unfortunately that didn't hit the media headlines, right? So a lot of providers are still telling women that estrogen causes breast cancer, and that's not the case. If it were the case, the highest rate of breast cancer would be in pregnant females. Pregnant women have 10 times as much estrogen surging through their bodies as non-pregnant women, and pregnancy is protective when it comes to breast cancer. Or young women in their 20s would be the highest risk group for breast cancer because that's when we have the most estrogen. That's not the case. So I spend a lot of time in my visits with women trying to convince them of the fact that you need estrogen. The number one cause of death in women is heart disease. And estrogen protects your heart. You need it to protect your bones. You need it to protect your brains, not to mention your sexual function, which is important, even postmenopausally. You know, just because we're not able to make babies anymore, we still have a lot of life to live, and we still have a lot of worth, and we deserve to feel good.
Jennifer, one of the other things too that you treat, and it's very prevalent too, being in the Northeast, is Lyme disease, and also long COVID. Let's talk a little bit about both of those.
Okay. So between menopause, long COVID, and Lyme disease, I feel like that population is a very marginalized population in our healthcare system. So again, Lyme disease, very controversial. The mainstream medical community doesn't believe in chronic Lyme disease. I've been treating it for 12 years, and trust me, it's awful. I've seen patients that have been dismissed by infectious disease providers and by their primary care doctors who end up with ALS, Parkinson's-like syndrome. I mean, it's horrible what Lyme disease does. It ravages your nervous system, your musculoskeletal system. It can be extremely devastating, especially for little children. My partner, Natasha, in my practice, she treats children, and she does it beautifully. But when a child gets a tick bite with an infected tick, it can literally destroy their genetic potential. So yeah, it's very controversial, but thankfully Lyme and long COVID are getting a lot more attention in the media now, as is menopause care. So that's exciting.
Do you think our healthcare, like we'll see a shift anytime soon in just the model that we have here in the U.S.?
Not as long as Big Pharma is in control of everything. I'd like to be optimistic, but you know, I think also medical school is very expensive. You know, we're understaffed. The healthcare system is understaffed. I just don't know if that's going to change, and it's unfortunate. And you know, unfortunately, hospitals are losing money. I don't know, there's going to have to be a very seismic shift in order for that. But the good news is more and more providers are doing what I do. And because there's a demand for it, and more people are looking for that type of healthcare because they're seeing where the conventional system has failed them and their family members and their loved ones.
I must say, in the last couple of years, you know, maybe the last year alone, I've been reading more and more about the benefits of HRT and doing your own. You have to be your own advocate too.
You do.
That's what's most important. Well, this has been a great discussion. I really appreciate you coming on, Influence Her, and speaking with us about these important topics, especially for myself. But Jennifer, thank you.
Thank you so much. It was great being here.